just see how many people are on it. All right, everybody, we are now finally going. Welcome to Tuesday night workshop at Monarch Family Chiropractic. I'm Dr. Kristen Zawada. We are going to talk about low back pain today and just some of the components around it and some of the basics. So there's so much we can do. This could be all day lecture. And we're going to just tap into components of low back pain and components of pain and components that play a role in all pain. So we really like to first start off talking about how pain is an electrical signal that is an interruption and interpreted by the brain. So that can be different than what people perceive and understand pain to be. And so I think I'm just going to repeat that a couple times. Pain is an electrical signal that it's an interpretation by the brain as to of what's going on and that something isn't functioning right. When we talk about things in a big global sense, it's one of the leading causes of disability. It's one of, if not the most highest cause for people missing work or being out sick, whether that's true disability or just missing days. It's a very high percentage of our doctor visits when it's coming, when I think about common pain, different than disease states, but dis-ease that we call it when their body is in pain. And the only thing that really beats that is a lot of respiratory infections and people going to the doctor for those reasons. There's a lot of support around doing components that support back because this becomes such a global problem with people missing work and then that becoming either workman's comp injuries for some businesses, which is a very expensive thing to take on. And they know that supporting people in their healthcare and in their function of their body then decreases usually their sick days and their injuries. And that's a much it's much improved for a business when you think about big companies and the money that gets put out for that when people injure themselves. So a lot of that too is avoidable. And so it's really great to see companies and businesses going towards supporting health and supporting movement and supporting their bodies functioning well, because they know that ultimately that saves them money in having people out sick, replacing them and paying for medical bills or disability bills. So it's really important that we recognize that, because that's not always where an office or a business is mainstream in thinking. So a lot of stuff is mechanical, meaning it's not caused by other serious conditions. Is why pain exists, and that there is a huge amount, as you see, 50 billion spent on back pain, and then goes into the things of like I was alluding to, lost wages and productivity for places. So that really extends that cost to almost double. So when we look at structure and your spine and what kind of things we would look at when we have back pain, we're really looking at degeneration, which then causes arthritis. And then what causes both of those things to happen at a faster and higher rate is what we support in the office by adjusting is vertebral subluxation. When a structure is not aligned properly, which is what a subluxation definition is that proper movement and alignment of our structure of our spine. We are going to compress things, and we're also going to create tension and or rubbing and a malalignment or mismovement of the spine. And over time, that creates the degeneration phase. Things are not rubbing and moving fluidly on the left and the right, or the front and the back side of the vertebra or the joint, which then causes most of spine injuries. The healing time is another component and what creates that. So there's a lot of movement that is helpful in addressing when you have low back pain. But even just looking at the stages of degeneration, when you're looking at that picture on the left, or that's part of the spine on the left right here, that's really showing us how a spine should look and how it should have movement and support. So many times by the time someone comes to us, there could already be a disc injury, and that is the cushion, the gel-like space that is between each bone, each vertebra in our spine. And so that's helping the bones not touch. That's keeping space between them so that they move properly. And most importantly, so that the space on the side of them, so I'm gonna try to use my pointer so you can see what I'm talking about right here, on the opening between on the left and right side of each space there between the top and bottom bone there, say this is the low back, is where the nerve has to exit. That's where the signal to all that part of your body is coming from. So the spinal cord, in quick review, is coming from the brain stem, coming through the spine, and those spaces, those disc spaces, are what help keep the opening where the nerves have to exit on the left and the right open and free to do the signal and send the information to the body that it needs to. When that space gets compressed or the movement of the spine isn't fluid, then it starts breaking down the joints, the bone, the discs, all of that, those components of the ligaments faster. So then you start to see bone that starts to look more compressed, like the second picture, where the disc is kind of like what I described in other workshops we've done this last month or two as the jelly in the donut. It's got to go somewhere when you start compressing or pushing on it. So if you bite into a donut or you push on it, the jelly's going to come out one end or another or a side when there's enough pressure there, right? It's really no different with the disc. It's a gel formation and it's meant to stay in that spot. And the more we compress it or don't move properly, then the more that ages the spine. The spine should last, based on science and research and putting force into the spine with the technology we have these days, easily 80 to 100 years with very little degeneration and wear and tear if we take care of it properly. So they say that a spine, the structure, original parts and pieces could last well up to 125 years if we started caring for them earlier than we do. Many times by the time someone has pain, and this is a whole nother workshop, so I'm not going to go down this route, but when we talk about where pain comes from, it's only a small 10% portion of what the nerve system does and feels. And so that pain showing up usually means there's already a fairly serious problem. The degeneration usually is already there. The arthritis is usually already there. And then that space is being taken up and compressed. So how do we remove that? And what are we doing about it? And we really go to some of these facts first, because this is what most of our population is doing about it. It is the most common reason for opioid use and prescription is low back pain. So I think many of us in this day and age, if you're following any of the science and the programs that are out there for helping opioid addiction, is because of how prevalent it is and how much it could be avoided. And it's not what should be the first prescribed for someone with low back pain, but it tends to be. So then we see a percentage of people who are getting into heavier even drug use because it started with the opioid addiction and how addictive it is and how prescribed it is. So when we look at chiropractic care, we're using the same receptors to do what an opioid does. So providing a lot of pain relief, but again, without a side effect of addiction or a lot of side effects of just what drugs do, even if it's not a highly addictive one like opioids are. So comparing to primary physicians, and you can see how the stats there on that poster as far as opioid overdose versus a car crash. I mean, those are staggering numbers, and we know how prevalent car crashes are. So you can look through those stats, and it's one of those things that when we are comparing to primary healthcare physicians for management of other types of pain, we're the second most often consulted. So we're looking at things though, because we have a higher success rate. And a lot of that because it becomes where there's no side effects associated with getting adjusted and having chiropractic as there are in all these other pain management techniques or methods. So lowest referrals for injections when people are under chiropractic care, really also the lowest for having to be referred to for surgery when we can intervene and be in the healthcare team early on and first. So we don't have to do as much imaging when we're catching a problem early and we're supporting it with chiropractic care. So there's also another fun screen about, I feel like, how treatment plays out in just percentages, right? So in a return on investment. Looking at how many people in percentage are asymptomatic or have a much more relief when you're combining chiropractic in the mix versus just medications. Not just improvement in their overall health status, but it's a really huge thing to see that line with adverse effects, right? So there is a time and a place for medicine, and there's certainly a time and a place when sometimes we have to manage how uncomfortable someone is until we can get the proper care going to decrease that stress in the system. And it should be a very short-lived period of time for multiple reasons, but addiction really, in an instance of talking about low back pain, as the primary reason, if nothing else. Let's not add things that create more side effects. Let's add things that create less side effects and more results. So looking at how it is affected in a sense, the brain, what we talked about when we first started is how we're interpreting a pain signal from the brain. You lose your proprioception when your spine doesn't move properly. That's where sometimes you don't know where you are in space. And when you come in and we do your posture pictures and we're looking at like, where is your awareness of your balance and where you are in space? Many people don't feel like they're tilted or tipped or swaying until they see a picture of themselves, or they see the scale difference, right, of how they're balancing their body left to right. So there's a big piece of that when your posture and your spine gets poor, your proprioception decreases. Things that cause that are probably going to be no surprise to all of you on the call and then on the workshop today, because either you came to us for these reasons, or this is really you understand these components at this stage of care, that a lot of it comes from traumas that happen, but it doesn't have to be what we tend to think of like falls, car accidents, or major injuries. Micro traumas is really the number one cause, which is just the day-to-day things we do that we don't realize really puts a lot of micro stress and into the posture, into our spine, and into our movement abilities. So of course it comes from bigger things that are, like whiplash and concussions and falls, but a lot of what we see is repetitive motion over years. It's really important that we cover that it's not just physical, it's not just traumas. Low back pain for many people can be organ related, toxicity related, and it just presents as low back pain. So a lot of toxins and things that are in our foods and additives that we put into our body, some of that comes from the chemicals that are in the drugs we take over the counter or prescribed, and recreational for that matter. But other things are more environmental, and things that we're getting from the way our foods are preserved and or sprayed as far as their shelf life, really. And we also talk about in chiropractic a lot how understanding that pain is not driven from just traumas and or just a toxicity component, but really our thoughts. So we call this the 3 T's: thoughts, traumas, toxins. Thoughts is really that when you think about what your posture's like when you're happy, or when something exciting has just happened, or even like getting into football season, watching a game and, standing up and cheering and getting excited about something. We stand in an upright posture. When we're excited, we don't slump over. We're not in a poor posture. Think about things that are, when we think about a happy position, I rarely think of something that's where my head is down or my shoulders are crunched or I'm slouched in a chair. But there are pieces of life that we go through that can be an emotional component, or things that are driven around how it makes us feel. And that takes us into a more slumped posture. It takes us into less oxygen getting into the brain. It can be something as far as just what we think. And when we are having a negative thought or having a negative experience, we have a completely different chemistry that comes into our body, right? Our endocrine system we have different hormones, just like you have your happy and your sad hormones, and your calm versus your excited hormones. All that changes in our system when we're having a positive experience versus a negative experience, and or something emotional that can again be positive, like a wedding, or sad, like a death, right? So all of those things and all the things listed in that column create stress in our possibly more of our brains, right? What's between both ears, that also creates a negative, in a sense, representation into our body, and that can create pain in our body that doesn't have to be physical. So when something is very stressful or puts stress upon us, remember that thought component is changing chemistry in our body, changing our posture. I always tell people, even if you just want to experience what this feels like to yourself, I always tell people, take a deep breath or try to take a deep breath when you're slouched. So even if I was just slumped over in a posture on my cell phone, try to take a breath in and take one as deep as you can right now. And then let it out. And then sit up out of your chair, uncross your legs, right? Put your head over your shoulders over your hips, and just look straight in front of you and take a deep breath. 30% more oxygen gets in from your brain through into your lungs to your body and all your parts and pieces, just shifting your posture right there. So it's a component of where pain can really come from a position and a feeling and an emotion, not just from a injury. And I think that's just important to note that that's where pain sometimes can be very elusive for people. So knowing our options, knowing where to put time and energy when that is a component. When we spend more time in a crisis care environment, which is just pain management really, versus overall root cause, let's solve the problem, decreasing quality of health and wellness usually over time because it's a longer process with less result. There's usually more unnecessary testing that is happening, or scanning that may be happening that isn't, again, necessary. Definitely in research showing higher mortality rates, higher bills, more hospital days, more days spent at a doctor's office or in a hospital. So that is an option. And we believe we really provide a different option, that there again may be a lot of reason, and even some of you on the call today are ones where we're in your healthcare team. It is not all chiropractic and nothing of anything else. It's how are we supporting your most proper function and optimization of brain to body signal. Because if that compression is there, the pain will not change. If that signal is not clear, you will still experience pain. It's just the way in which the system functions. And so how can we support in other therapies, in other ways, giving you things to do at home and your self-care, knowing that not any one thing or group of things fixes somebody. It's that we're giving you the tools to do the treatment that is needed outside of someone's office. We're giving you support to get that, to work on slowing down degeneration and aging and giving it a proper position to be in, and then allowing, when you do that often enough, to do things outside of here that stabilize and continue that. So, and whatever else component needs to happen depending on the level of injury that needs to take place, whether that's, a version of physical therapy and occupational therapy, lots of other therapies decrease inflammation and pain and allow for better movement. Massage therapy, acupuncture, things that all support that system working like it's supposed to. And sometimes that does involve pain management at times with medication, but it should really be monitored and hopefully in short increments when absolutely necessary, so that we can really figure out where the body is discussing and telling us the symptom or the problem's coming from. And it is also huge that we talk about it all the time in here. It's a lifestyle choice, right? So something that you want to have for the rest of your life, we have to put energy towards the rest of your life. So when we are facilitating things like improving a diet that can decrease your inflammation, inflammation is a huge cause for pain. A system inflamed is a system with just extra stress on it. Exercise when appropriate and the right things, right? And the lifestyle stuff is really pretty basic. So even looking at this quote, this is coming from people that is straight out of, Johns Hopkins, very well supported and educated university, and where we're really looking at, it can't just be treatment as is the answer. It's got to be care and the right type of care and the right team So we love and appreciate that all of you are allowing us to be part of your healthcare team and talking in on the basics of low back pain. Obviously, there's lots of different components of what drives this. A couple components that are people always ask me things maybe they should not do that isn't necessarily here on our slides, is really looking at flexion motion. So if I'm going to end on anything as far as what things we should be watching that we are the best for our low back and those discs in that space, is things that are bending forward at the hips. So a lot of times what that can look like for people is cleaning, vacuuming, bending over improperly to pick up a child, or bending over to pick up anything off the floor, especially if there's any weight to it over 5-10 pounds. A movement like, vacuuming, a lot of forward pushing and pulling in that flexed position. Shoveling is going to become an issue here as we get into the fall and winter. Things that are really one-sided and repetitive. Raking, as we probably will hit before shoveling, when we start losing our leaves. So those kinds of activities in that flexed position. Sitting and car seats and posture for kids is also really key there. And something that many men still do is wear a wallet in your back pocket. And that should be something that nothing really should be in your back pocket when you're sitting, male or female. And that if it can't go in your front pocket, that it's got to be something that maybe goes in a shirt pocket. So that I know people don't want to take it out because they don't want to forget it or lose it or leave it behind, but it is really creating an imbalance in our low back and pelvis when we sit on things that aren't level. And a wallet's just a really good example that tends to across the board happen for men. So minimizing the size of it and just eliminating it from your back pocket. It'd be like for women if we walked around and one shoe was a tennis shoe or a flip-flop and the other one was a 1/2-inch heel. How long would that take to walk in something like that for any of us and it not create a knee, a hip, or a low back pain? It's very similar if we sit on something. And that can be, I don't know if you're all on the call, there's a few of you on the call tonight that asked me about this today, but this came up in conversation today, people who sit on their feet. Like I have patients who just tuck a leg underneath them and sit on a leg when they sit in a chair for a length of time, not just for a few minutes, or do that when they sit on the couch. So I would just challenge everybody to think about and look at where their postures are when they're sitting. It could be what's creating some of the low back pain and that really big imbalance in just some posture movements you're doing that you don't even maybe realize you're doing. And so there's cushions and things like that that can help support you sitting properly and give you support where you don't feel like you have to shift all the time and maybe tuck a leg in order to create like more cushion, is at least what patients today told me that's why they do it. So the answer isn't switch to the other leg or try to balance it out. It's let's sit with our feet on the floor, but put cushion underneath us, like a low back cushion in the low back, or even a 1-inch little foam wedge that you can sit on that just gives your sit bone and your low back some cushion and not such compression that if you have to sit, you're sitting on something with more support to not bother the low back. And lastly, because any of you have been on workshops, you've seen and heard Dr. Mayakin's workshop on sitting is the new smoking. Sitting is killing us. So if you have to sit for your job, it is compressing your low back more than anything else almost that we do. So the best thing we can suggest that you hear us saying here is set your own little alarm or phone timers or alerts that once an hour at minimum, you get up and move for a minute or two before you sit back down. We've got to get out of the sitting position, or low back is going to probably stay really high on the list for injuries and reasons people go see their doctor. So with ending on that, please ask us any of your questions in office that you have that relate to you, maybe more specific. And hopefully this gives you some knowledge of things to do and to not do in your day-to-day, and ways in which to be supported in your self-care to do things differently, because there are things that we just have to do. So we're going to sign off for now. I will try to open it up for any questions that you have. And thanks for joining us Tuesday night workshop. See you next week.
Thank you. Bye.
Thank you. Goodbye.